As you know, I'm Dr. Pacik, and we've been working on the treatment of vaginismus and dilators. And this is,
I am Ellen.
and you know us. The video is primarily to reinforce the things that we've discussed during the post-procedure counseling. This video is very specific for my patients who've been through the program, and Ellen and I spoke about the benefits of having something that you can fall back on, something that you can review, so that you can feel as though you're back in the counseling session and just going through the various things once again. It's a good, it'll be a good DVD to review every so often, and we're going to try to cover just about everything that we normally cover in the counseling sessions. So Ellen, I'm going to let you get started with, we usually begin our post-procedure counseling starting with some simple concepts with dilators. And we talk about the importance of a daily log. Why don't we talk about that first? Because I think that's probably the most important thing. You want me to cover that?
Yes.
So, keeping a daily log is something that we've spoken about and something that we feel is very, very important. For one thing, it allows Ellen and myself to really understand what you're accomplishing at home. For another thing, it really puts the responsibility on your shoulders to keep dilating. It keeps you accountable. And that's important because sometimes patients just fall off the wagon and they're no longer accountable. And the occasional failure that we have is when a patient is no longer accountable, she's not dilating, she's not emailing us, and all of a sudden a month goes by and we realize we haven't heard from a particular patient, and the patient has pretty much decided to stop dilating. And those are the patients who sometimes fail. For those patients who stay in touch with us on a regular basis and email us every day, that's fine, and we'll send you back a reply every day or two. Those are the patients who, that together with the dilation program, will be successful. I like it when my patients send the email to me and copies to Ellen and copy to Sue, and you will have all the information about our email addresses so we can stay in touch. So that's probably very, very important in terms of expecting long-term success. So from there, let's talk about the next thing that we want to talk about. We can start any place. Where would you like to start?
Well, let's start with dilation, and then I just want to interject that all of this information we're going to go over today about how to keep your dilation log, what specifically we want it to look like, is all in that yellow folder that you were given on day 2 after your procedure.
Okay.
So all that information is in there. And by this point, we would have already discussed, because you would have already built up from dilating the night before and progressing through the dilators here in our office on the second day, that you need to dilate a minimum of 2 hours per day. Now, Dr. Pacik's going to say an hour in the morning and an hour in the evening, because that is the optimal and the ideal dilation timing. However, we understand that life does get in the way, so it's 2 hours throughout the day somehow how you can do it. You're going to be sleeping with the dilator either every other or every 2 nights. You're going to sleep with the small purple dilator that you were given. This is our recommendation for sleeping. We do have some patients that prefer to sleep with the pink dilator. However, we think this sometimes causes a little too much tension and stress in the beginning and can cause some additional undue soreness. So it's completely up to you if you want to push the envelope a little bit and try the pink to sleep with it. However, know that you're going to sleep more comfortably and better with the purple dilator. So that is every other or every couple of nights. If you're experiencing some consistent soreness over the first 2 to 4 weeks that you can't seem to resolve, then stop sleeping with the dilator and see if it clears that up, because sometimes sleeping with the dilator will cause a little bit of irritation and soreness that the girls report. They can dilate easily through the day. However, the sleeping with it just makes them more sore through the day, a little more inflamed, and when they stop sleeping with it, they're more successful to graduate to larger dilators. If you have no issues sleeping with it, then continue on that every other or every 2 night sleeping cycle until you progress to regular penetrative, full penetrative intercourse. You're going to want to dilate 2 hours a day up to the largest size that you can possibly dilate. So, for the first couple weeks, you may be only to do the purple and the pink. We want you to start with the small one, use it for anywhere 15 to 30 minutes, and then put the large one in. Now here's where I cheat on the dilating a little bit. I don't want the 2 hours a day to be 30 minutes with the purple and then 30 minutes with the pink. If you're comfortable and you can find that time, I want you to stretch it for the full hour and the largest one that you can possibly do.
But that's a question of time.
It is a question of time.
Until they're comfortable with it, because when we review lots and lots of dilation schedules, and typically all of the patients are able to dilate purple, pink to blue. To the blue is the largest dilator when they're here with us for 2 days. But then we find that a lot of patients regress, and then the normal dilation that we get might be 30 minutes with the purple, and then just 5 minutes with the pink, and that's all they can tolerate. But in the beginning, don't worry about that, because one day it'll be 5 minutes, the next day it might be 10, the next day 15. Whatever you're able to do is great.
It is great. I'm giving you for when you can do it easily. I don't want you to cheat yourself out of getting that maximal stretch.
Right. And so the whole idea then, if you have the time to dilate in the morning and the evening, then the morning dilation becomes a piece of cake, because you've been sleeping with the purple all night long. And the best thing is you wake up, you take that purple out, and you start dilating right up to the pink, because you're already dilated from the purple. And that becomes an easy transition. In the evening, you may have to spend a little bit more time on the purple before you can get to the pink, and then ultimately the blue. Typically, our patients take about 2 weeks, I would say, to start getting comfortable with the blue.
I'd even venture to go 4 weeks.
4
before
weeks.
They're comfortable
Yeah,
with the blue.
it varies. It's just varies all over the place. And so if you can't do a longer dilation with the blue, we're happy for 5 minutes.
Correct.
5 minutes with the blue is better than no minutes.
And the blue does not get inserted all the way. Please remember that. The blue is far too long for the average vaginal canal. So if you have it inserted this far, you definitely have gone past your 3 muscles and you're dilating them evenly, and that is completely expected and acceptable. If you can get it in all the way, fine, but it does not need to be forced all the way in. Same with the pink. Some of you will have a shorter vault than others and a shorter canal. The pink can hang out an inch or so, and that's okay as well. You're really looking for about this much space, just a few inches, to get in to evenly dilate.
What I would say is that the most we need is this much of the dilator to be in, and the part that's from here down to the disc does not need to be in. And most vaginas will not tolerate anything more than about this length. So it is normal for the last 2 inches approximately to be out. And there's just another thing, and that is that most of my patients have spasm of the bulbocavernosum.
Correct.
Most of my patients do not have spasm of the muscles just below the cervix, further into the vagina. So when we're speaking about spasm of the bulbocavernosum, just to remind you, this is what it's like at the time that you're in the operating room under anesthesia. And it is just like a closed fist that you can't enter into. So the bulbocavernosum is only about, let's say, this much of the dilator. That's it. And then you have the pubococcygeus and the puborectalis. And these muscles are usually not in spasm, and so that's another reason you don't have to work so hard getting the dilator in too far. And the other thing that we want to avoid is if you're trying to get the dilator in too far, then you're going to be bouncing off the cervix, and that's going to be uncomfortable and irritating. So, and I would also add one more important thing to this, and that is that when you insert the dilator, always try for a nice clean entry. We don't want to be bouncing off various walls. If there's an area that's uncomfortable, it means you may have traumatized it. So try to stay away from that. Try to have a lot of lubrication, a nice clean entry into the vagina so we don't irritate the structures on the inside. So if you do find that you have an area of irritation, then the treatment for that is to take a little Tylenol, take a little ibuprofen, maybe lay off the dilators for a day or two, which is not the end of the world, or use the dilators a little bit less. I would also say that it's not really necessary to dilate more than 2 hours a day. I have patients who are very, very motivated, and they're dilating 4 or 5 hours a day, and that's more than is necessary and can cause some irritation and some pain. So pretty much 2 hours a day is fine. Sleeping with the purple is fine. Some of my patients sleep with the pink and they're comfortable, but it's not needed. And I would say that if you sleep every second night with the purple dilator, or every night as some patients do, and dilate 2 hours a day, that's really sufficient for what we need.
It is very sufficient. And if you have to take a couple days off because you need a rest and you have a hard time getting the purple dilator in, please remember you can back down to the small blue dilator and then graduate up again. If you're having problems getting any size dilator in, just back down to the smaller one underneath it and attempt that. Leave it in for 10 to 20 minutes, give it a nice stretch, and then go to the next one. Now, where Dr. Pacik was saying he likes a nice clean entry with the dilator, especially for these first 10 days while we're waiting for the Botox to become fully active and we're working on stretching those muscles, I'm going to explain to you with a rubber band what you're going to feel. Because lots of times you're going to go in, and that's the bulbo cavernosum just pulling, and then all of a sudden you're going to slip through and go through nice and easy. If you can take a deep breath, relax, do a couple of Kegels, just like we worked on here in the office, and really trust yourself, and then angle a little bit more towards your rectum and give one little push as you're releasing that Kegel, that's how you get past that rubber band effect. Remember, we pulled, and then you went right in and there was no resistance, and it's at that point where everything got comfortable. Just remember me in your head saying, take a deep breath and go in nice and easy.
Okay, so why don't we discuss then some aids in terms of making dilation easier. What would make dilation a little bit easier for the patients? Let's start off with a patient who's doing well with the purple, struggling a little bit with the pink. What could she do that might make dilation a little bit easier?
Well, if you have a partner, don't forget to get your partner involved so you can start to put your partner and assimilate him with penetration without pain. So you can get used to your partner's touch while you're inserting the dilator, either on your thigh or on your hand or on your abdomen, stroking your hair, wherever you're most comfortable with his touch. That can often distract you. If you have a very strong, connected relationship, and then looking in each other's eyes, some of you have practiced that with you here in the office, and just getting lost in whatever moment you guys find workable for you, that you can both get lost in and distract yourselves. So you want to distract from whatever point you're getting stuck with that dilator. Whether it's a song, I've had couples sing songs to each other, play their favorite music. I had one couple who loved the show Brothers and Sisters, so she always dilated to DVR shows of Brothers and Sisters because that's how she got lost. You can also use a small clitoral stimulator, which we'll go over in more detail later, but something to kind of excite you and distract you while you're dilating. Some people like to read a book. I've had very religious couples who would read a passage out of the Bible or do a daily devotion, either while they were dilating, just before, or just after, because it seemed to distract. So the key there is distracting. Whatever you can get lost in and help you forget that there's a dilator going in and out is where you need to go. Whether it's shoe shopping, to a beach, somewhere together, a song, anything like that is what you really need to draw on.
How about discussion of how Kegels might be helpful with dilation?
The Kegel exercise, your vagina is meant to be naturally expelling and naturally pulling inward as well. So it's meant to pull things in and push out. So in the height of arousal, it will actually pull the penis in for intercourse and for mating. And then obviously it's meant for expelling things and releasing once intercourse is finished. And then that's also how we birth a child. So the Kegel muscle, whenever you tighten it, you can actually focus on your abdominal muscles by putting the hand here, like we've gone over. Do that nice Kegel, tight, 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 feel it tight. And when you release with a deep breath, give just a little push to the dilator and it'll actually pull it in. And then just stop when you feel resistance, repeat that same process again and keep pulling it. It will actually keep pulling it in slowly and slowly. Plus it helps your mind and your body take control of those muscles and kind of boss them around and tell them what to do, versus them kind of keeping you captive like they have for all these years that you've been suffering. And then once you're in a relaxed state, the more you do the Kegel around it, the more you wear it out and tire it out so that it relaxes. So when the dilator's in place, do Kegels every once in a while, especially if you feel your abdomen start to tense up, which some of you will, some of you will not. But that hand on your abdomen that we go over and the deep breaths, just really pay attention and be in tune to your body. You have to give full focus to your body at this point. And then when you're ready to remove the dilator, a Kegel will also help you release it.
So basically, for those who may not know what Kegels are, and they can be pronounced Kegels or Kegels, it doesn't really matter. It is basically a tight squeeze of the pelvic musculature. So you squeezing, and then you release. And the squeeze is not any different than if you have to go to the bathroom and you're trying to hold it in and you're squeezing, and that's basically you're doing a Kegel. So what you do is you'll do, let's say, 5 sets, 5 Kegels. So you'll do a long squeeze, you'll hold it for approximately 5 seconds, whatever is your level of comfort. It could be 10 seconds, it could be 3 seconds. Different people have different pelvic structures and different strength in their pelvic structures. And so you just do a strong Kegel, and then you completely relax the pelvis. Then you go back, you do another strong Kegel, you completely relax the pelvis. And then on the 3rd time, or the 4th time, or the 5th time, you do a strong, strong Kegel, hold it, hold it, hold it, and as you relax, then you push the dilator in a little bit further. Let me have one of the dilators here for a second. So, what happens again, you know, we've got that very tight bulbocavernosum, and even with the Botox in there, that's still going to be tight for a period of time, because everything just needs to stretch out. And so with these Kegels, you can, every time you relax that pelvis, then just allow that to go in even another ½ an inch. And what you'll find is pretty much what Ellen just showed you with the rubber band. There'll be a certain point when there's no more resistance and the whole thing just slides in. And one of my patients said that the dilator went in more easily when she was actually bearing down. So most of my patients, you bear down, you do a hard Kegel, and then you relax. But this patient found that she was actually able to push the dilator in a little bit better when she was bearing down.
It does help you keep the track better because they don't completely close to this point. It's just a tight contraction, and so you don't have the looseness around it. A few of them do.
Mm-hmm. Okay.
Do say the Kegel helps keep them on track better.
Okay, so let's take a hypothetical situation now. So we have Nancy, who's been with us 2 weeks ago, and she's sleeping with the purples, and she's struggling a little bit with the pink, because you have to understand that it's not a totally smooth ride all the time, and patients get discouraged with that. So I have to warn you, it's not necessarily a smooth ride. You may have days that you're dilating beautifully, you'll have days when you're dilating not so well. And there are going to be frustrations if you're not dilating well, because then it scares you that you're losing ground, you're regressing, and all of these things are just temporary setbacks. And temporary setbacks are actually very, very common in the post-procedure dilation program. So let's say now, Ellen, we have a patient and she's 2 weeks out since her procedure, and she's sleeping with purple, and she's actually sleeping with the purple every second night. She's doing well and she's dilating. And I get this email every once in a while, and all of a sudden, it's just not working. You know, they're just struggling, putting in the pink, they can't get back up to the blue. They're having some days of struggle. Any suggestions?
Sometimes it's a social factor, sometimes it's an emotional factor, sometimes you set an unrealistic goal for yourself, like our anniversary is coming up in 2 weeks and I want to be able to have intercourse or at least be able to dilate with him helping me, or my birthday's coming or his birthday, or we're opening a business. There's no cookie cutter recommendation. There's our baseline recommendation, but each vagina is different and each woman is different, each relationship is different, each couple is different, each situation is different. There's no cookie cutter thing that says you have to do this. We have to be very careful and very sensitive to you, and there could be 100 different reasons why this isn't working. You could be premenstrual, so it could be a little tighter, a little more sensitive. You could be experiencing some emotional stress that you don't realize is actually backing you off, whether it be an exam coming up, a promotion at work, a change in the office setting, or even a move at the house. So it is not failure. I know it's not easy to dilate with these dilators because, like I told you in the office, I've actually tried them so that I know what you're going through. I know that they're awkward and that they're uncomfortable, and I don't have any of your problems. Just know that you have to take a deep breath, take a step back. You made this commitment already. You came here for the treatment, which is a very, very brave step, and you're committed to dilating and you're doing a great job. And sometimes it's just like a star athlete who has a bad day. He has good days, bad days, and just okay days. So we're looking for mostly okay days and a few really good days, and we're expecting a few bad days because that comes with the territory.
Okay, well said. So really the bottom line is, don't worry if there's a regression. You can always take a couple of days off. You're probably going to take some days off anyway during your menstrual cycle, and all of this is normal. I don't think we have, it's a rare patient that just cruises through the post-procedure dilation program, gets up to the blue, has intercourse after a week, and we do have those patients. But there's also a lot of patients who struggle through varying times with the dilators. So speaking about menses, when they would be taking some time off anyway, is this a good moment to transition into that? Okay, let's talk about menses, and why don't you pick up on
So you can actually dilate during your menstrual cycle. Obviously the heavier days are going to be a little more difficult, but the lighter days are going to be easier. It's completely up to you and your comfort level what you choose. Some of the girls are so afraid that they're just going to close back up like a book that they try to dilate as much as they can. It is completely safe to dilate during your menstrual cycle because this is a non-porous object. So it's not going to trap the blood and harbor the dangerous bacteria that you hear with tampons called toxic shock syndrome that will cause that. So you don't have to worry about it. You just need to be clean. It is going to be slightly more messy. You may need to wear a heavier pad or a covering on your mattress when you're dilating or whatever, but it can be done. It is most easily done with the smaller dilators because it still allows the blood to escape and be a little more comfortable. You will be more tender during those weeks or days surrounding your menstrual cycle. You will also be a little more sensitive to how the dilator inserts, and you will need to kind of judge your lubrication a little bit more because obviously there will be more moisture. But it's completely up to you, and it's okay to take a few days off. Usually they just dilate on the light at the beginning or the end, and they take the mid-days of heaviness off.
So the feeling that we have is if you can dilate for even 5 minutes, again, it's better than 0 minutes. And if you just can't because the flow is too heavy or you're too uncomfortable with it, then it's not something that has to be done.
If you're having cramping and you take a warm bath, try to dilate in the warm bath. That's an easy way to get around your menstrual cycle as well. And a warm bath helps on regular dilation days without your menstrual cycle.
So as the menses are finishing, then what you may want to do is begin dilating with the smaller dilator, the purple one, and start working back up to the pink and the blue, especially the first 1 or 2 times where the vagina may have lost some of its stretch, you want to re-stretch it. So never be concerned about going to a smaller dilator and then working up to a larger dilator. And speaking of menses, this is a great time to try using the tampon.
It is a perfect time, but I'm going to back up just a little bit. If you're one of the patients that we have recommended that you are dilating with the dilators below the purple, then you start at the mid-size lower one that's either the blue or the pink just below the purple and carry on the same way that he just described to get back after your menstrual cycle. And when you want to try a tampon, it's perfectly fine to try a tampon. Just remember these few easy things. Even myself with no issues, took me about 10 or 12 tampons to figure out which one I liked best. Tampons you're not supposed to feel when they're inserted. If you remember exactly how you're inserting your dilator and what angle you're inserting it, you're going to insert the tampon the same way, whether it be one with an applicator or without. And then when you seat it in place, you'll actually feel the rings, just like you feel the dilator go past the rings, you'll feel that with the tampon applicator or with your finger if you're using a non-applicator one. And it should be in a comfortable place that's about a finger depth in, so that you can't really feel it when it's in place. Now, not all tampons are made equally. They're all different shapes, and so they do feel differently in the body. So if the first one you try doesn't work out well, try a different brand. It may take you a few tampons to try to figure out which brand is most comfortable for you. Some of them open up to a cone shape, so they do have a little bit of a tug and a little bit of discomfort when you're removing them. I would recommend the first times that you use them that you use a light panty liner for any leakage or even a light maxi pad of some sort. If you find yourself especially dry after the Botox treatment, use a little bit of lubricant on the end of your applicator for your tampon. Also, every tampon box on either the outside of it or an inside insert has a little diagram on how do you insert it. Just read it and follow that as well, and take a deep breath. If you've practiced putting in your dilator standing up, that'll be an easy way to insert a tampon. You can insert one lying down if you'd like. Just follow with what's comfortable, and even the menstrual children, when they start their menses right around junior high, it takes them a few times to figure out a tampon, and it's not always an easy thing to do. There's different sizes. You can try a light one on light days and graduate up with your comfort level to heavier ones. Just make sure you don't give up, because that's our second favorite email after I've achieved intercourse is I went to the beach on my period. I love that one.
So this is a good time to talk about cleaning the dilators.
Okay.
Okay, you want to take it?
Oh, sure.
Basically, it's normal soap and water.
Normal
There's-
soap and water. The best soap that you can use on your vagina is Dove Sensitive Skin with no fragrance in a light green and white box. You do not have to scrub your vagina, and you do not have to scrub your dilator. Over cleaning your dilator or your vagina will interfere with the normal bacteria or the normal flora that you're supposed to have in there, and can cause a vaginismus or vaginitis, and sometimes cause a yeast infection because you've cleaned it up too much. You can also wear away at your dilators by soaking them and scrubbing them. So I would recommend just washing them off with warm water after you use them. If they're really soiled, just a little bit of light soap and wash it off. You can also buy some toy cleaners or dilator cleaners, but they often have fragrance that can be irritating. So you just don't want to over scrub anything. Just keep it nice and clean. It's not like you're sharing it with anyone else. It's your body, your fluid, your dilator. You just have to keep it clean, not sterile.
So we don't need alcohol preps. We don't need any of that
No,
stuff.
you don't need
You
betadine.
don't need
you don't need
betadine. As a
liquids.
matter of fact, when I inject Botox into the vagina, I never use betadine, because I did that on one patient. I upset the normal flora, and she wound up with a vaginitis. And the other thing that some patients are just a little bit more prone to yeast infections. And sometimes there are patients that routinely get yeast infections after intercourse, and some of our patients occasionally get yeast infections after dilating. And it's just simply because women can be more prone to a yeast infection. So as far as the potential complications and some of the risks of dilating, then this might be a good time to talk about yeast infections and bladder infections, because once in a while a patient will complain about that, and let's talk about that for a moment.
just because of the increased activity in the area and sometimes the compulsion to over clean can induce a yeast infection. If you have a white discharge that's creamy and doesn't smell, that's actually normal, which you will notice on the end of your dilator, on the end of your partner's penis when you're attempting intercourse, on the end of whatever you're using to dilate. You will notice that once in a while. That's completely normal. If it's cottage cheese-like or a little chunky and kind of cakey that you can do this with, that's yeast and it will smell yeasty. It'll also cause itching and kind of some burning a little bit on your vaginal walls. That's a yeast infection and that needs to be treated. Just remember, mild soap, you don't need to scrub yourself, and make sure everything's rinsed off. I even teach my daughter not to use soap on her vagina every single day because it's just not the healthiest thing for it. You need to learn to keep that balance, and we've interfered with your parasympathetic nervous system, so we're kind of interfering with your balance a little bit and your lubricant a little bit, so we just need to be a little more careful that we don't get crazy and scrub the area. As far as causing a bladder or a UTI, first you would have a urinary tract infection and then it could potentially lead to a bladder infection. That's just from increased activity in the area and bacteria getting into your urethra. So you always need to make sure that you wash from front to back. So you start at the top and you go around. So you start where your clitoris would be and wash towards your anus always. And that's the way you wipe as well. When you're wiping off lubricant, when you're wiping yourself after you use the restroom, just wipe that area. And if you feel that you've gotten really messy with lubricant, instead of washing with soap a couple times a day, I'm going to caution you, just use nice warm water and gentle pressure. And drink lots of fluid. And you'll notice a UTI with a little bit of burning sensation when you urinate. Sometimes when it progresses up into the bladder, you'll get that pelvic pain. And then just either call your doctor or call the office and we'll help refer you or help treat you to handle the bladder infection. That happens very rarely, the UTI and bladder infections, but most people that are prone to them will get one with the increased activity in the area.
So what should a patient do if they feel they have a bladder infection? The symptoms of a bladder infection would be frequency, where you feel you have to go to the bathroom repetitively, urgency, where it's kind of urgent, there can be burning. So, I mean, the simple thing is to just contact your doctor.
Correct.
Because most likely you would want to be on an antibiotic, and very often Cipro is a very standard antibiotic that's used. And it can happen, and if that happens, then you just call your doctor and get treated, because most of the patients that we see are from out of town, and I really prefer patients to communicate with their family physicians for any difficulties with treatment. As far as yeast is concerned, what would you recommend for that?
Well, they do either need to see their family physician or their gynecologist, and I want to caution you that don't be afraid to call a doctor, because a UTI and a bladder infection does not warrant a vaginal exam. It's just a urinalysis quickly. For the yeast, they can actually just take from the outside of the vagina the yeast that has come out and diagnose you. You can use over-the-counter Monistat if you would like. However, if it doesn't resolve within about a week, then you do need to go see your doctor and possibly be treated with a fungal medication.
And the fungal medication is normally diflucans, and 1 or 2 doses of that usually eradicates a yeast infection. So these are all things that can happen. Don't be afraid of them, and if it does happen, the earlier you get treated, the better, because the more quickly it'll disappear.
And don't be afraid of the doctor, because we know you're not ready for a pelvic exam yet, but these don't require full exams like that to be treated.
And by all means, tell your doctor about your treatment. Past medical history is very, very important for every physician. So if you're going to go to your doctor, tell them that you were down here at Dr. Pacik's office, you were treated with Botox for vaginismus, and oftentimes they're not going to really understand what this is all about anyway, and this is a great time to educate doctors, because it'll be very helpful to them to know a little bit more about vaginismus. So I think we've covered most of the things now. You have something else?
Nope, we need lubricants.
The lubricants, yes.
Dilating,
Okay.
because that'll make everything else easier.
Okay.
Lubricants and positioning,
Okay.
actually. Be good.
Well, why don't you're the expert on lubes? Go ahead and talk about lubes.
We gave you a lubricant to use here in the office that's 50% Surgilube and 50% 2% lidocaine jelly. We want you to wean off of that as soon as possible because it can cause excessive dryness and some irritation if used over a prolonged period of time. We caution you to use not flavored and not scented lubricants. They're very high in glycerin and fragrances that can be very irritating and drying as well. We want you to use whatever you're comfortable with, whether it be silicone, a jelly, a water soluble. This is the new thing that everybody's happy with, the slippery stuff. It's glycerin free, water based, non-staining, and doesn't leave a residue. It's very, very comfortable. You can buy the Surgilube through us. If you didn't buy some when you went home, just call me and charge you our cost plus shipping, and I can ship it right out to you. But you want to remember that the Botox inhibits your natural ability to lubricate your vagina and that natural letdown ability, which we will touch on more a little bit later. But you need to make sure that you remain properly lubricated for all of these situations. Even remaining lubricated will help control a yeast infection, help prevent a UTI, and just keep things in their place and where they're supposed to be and naturally working the proper way.
You want to continue with positions then?
Sure, we can. The positions of dilating.
Mhm.
You don't have anything to add for lubricants?
For the lubes? Yeah, we try to stay away from the glycerin lubes, that's for sure. We don't want anything that creates heat. Some of my patients really like the slippery stuff. We've had a certain number of patients that have had allergies to the preservative parabens. So they have a parabens allergy, and slippery stuff does not contain parabens. The other thing that you should know is that the xylocaine jelly does cause a little bit of burning. And the xylocaine jelly is really not necessary for more than a couple of days, because by that time you're dilated and by that time you're doing well, and we recommend that you just use a routine lube, and that works quite well.
If they read the ingredients on slippery stuff, it actually contains a methylparaben, but it's a very, very minuscule, minute amount, and it's the non-reactive one.
I see.
So it's usually the other parabens that are the reactive one. So just use caution if you do have a paraben allergy, but this tends to be the most hyperallergenic because it doesn't have the alcohol and it doesn't have the high amount of glycerin that a lot of them do.
Right. Well, we had a patient down here that was very, very allergic to parabens, and she brought along she's the one who introduced us to slippery stuff.
Yes. And back to the warming and the cooling. They seem exciting, and once you're having penetrative intercourse, and I'll touch on this again a little bit later just to remind you, they contain a large amount of alcohol. When I say a large amount of alcohol, I'm saying it's the second ingredient in almost all of them. They will sting, they will burn. It's not something until you feel completely comfortable with your sexuality and your penetration and your connection with each other and your own lubrication and let down, both his and yours, that you should try those, because it's going to make you want to get up and run to the shower and rinse off if you're in a even little bit of a dry state. That tingling will actually turn into a burn.
I think what we could do is we could interject, some of our patients have menopausal vaginismus, and menopausal vaginismus is a secondary vaginismus. Primary vaginismus is where you've never been comfortable with any kind of penetration, but in secondary vaginismus you've been comfortable for a period of time, and then something happens where vaginismus becomes a secondary situation. And one of those things can be a patient who becomes perimenopausal or menopausal. And so one of the things that we recommend is either some hormone replacement or some estrase. And the estrase can help also with a certain amount of lubrication and also allow the vulvar tissues to become more robust.
Yes.
And so I'll just throw that in for the occasional patient that may be perimenopausal or menopausal. That's an important aspect of the post-procedure care.
An important thing with lubricants as well is that with some of them you can notice some external irritation. Remember the few patients we've had with the external irritation? That can either be a lack of lubrication or too much lubricant. So if you can't resolve it by changing the lubricant, then try to adjust the amount of lubricant that you use, because you can cause some external irritation there.
Okay, great.
Just some rubbing of the tissues and rawness over there. So
Do you want to move on to positions for dilation then? I
Sure.
think that would probably be helpful.
So we'll get into positions a little bit more when we get into progressing towards intercourse, but I really want to encourage you to try to dilate in different positions. And when I say that is because you are going to have a different level of control in your situation and the level that you are comfortable with either giving up or maintaining. I have had patients who cannot dilate on their back, but when we switch their position from the back position with the frog legs to either standing up where they're in control or on their side, or rolling over and kind of doing what we call a modified canine position or on all fours to dilate, they're much more successful. Plus it helps you when you progress towards intercourse to know what's comfortable or not. So you can try to put a pillow underneath your hips, you can try to roll on your side, have a pillow under your legs, between your legs, you can stand up with 1 foot raised. Just experiment, look at the books we gave you, look online at positions, just experiment with where you're comfortable, because you don't just have to lay on your back in what's known as the submissive or missionary position to insert the dilator, but sometimes that's the most relaxing. Other times it's those other positions that give you the amount of control that you require to be successful.
And don't forget to include your partner.
Include your partner, it's a perfect
You know,
segue.
it's your partner is going to be a part of this, and the sooner your partner becomes a part of this and helps you achieve your goals, the better. And let your partner work with you with different positions with the dilators, so that he can also get a feeling as to what's comfortable and what's not so comfortable.
That's very, very true. So he'll be able to watch the way you dilate, the position you dilate in, even assist you by letting his hand be on the dilator and your hand, and him following your guidance. He can tell what speed you like to be penetrated, at what depth, at what angle, and he is going to feel like part of the process. It's going to be a great bonding experience for you, and believe it or not, he doesn't think it's gross or boring. I know that most women are a little self-conscious about their body, plus you're self-conscious about this open position that it's left you with very little privacy, but don't forget that he's with you and committed to you, and you're going to be naked together when you have intercourse. It's okay if you're half naked or fully naked, dilating and practicing the different positions together. Let him touch you in different areas. Let him spin the dilator around, even move it in and out a little bit while it's in place, and work on your romance and bonding together. It doesn't just have to be a boring dilation session.
Well, do we have anything else that we want to discuss, or do we want to move on to transitioning to intercourse?
I say we move on to transitioning to intercourse.
This is something that patients sometimes struggle with, even though they are successful to this point. Some of our patients continue to have anxiety. Some of our patients continue to have anxiety as it relates to penile penetration. Some of our patients struggle with low libido and therefore don't get turned on by the entire process. And that's what we'll be covering now in this next segment, is a couple of tricks in terms of progressing to intercourse, making everything more fun, less mechanical, because up until this point, everything has been fairly mechanical. And so we have to get beyond that also, not only for the female partner, but also for the male partner, very important. So Ellen, why don't you take it from the top, transitioning to intercourse.
So it is going to be very mechanical at first, but I want you to go back to that homework that you were given the first day of dilation, where you bonded together if you had a partner and you did it together. So you really need to get him involved in the dilation process to be the most successful in the very beginning with penetration when you move towards that. And I don't want you to put a timeline on it. You can have penetration anytime you're comfortable. We've had from people having intercourse the second day, not even full penetration, which is partial penetration, like we're going to talk about, to 9.5 months, I think was the longest period of time reported. Now obviously the Botox is already worn off, so they're just using dilation to keep them open, and they weren't ready for intercourse until that time. So there's no timeline on this. I also want you to remember and keep in the back of your head that practice makes perfect with penetration and with intercourse and with discovering your sexual identity. That's why all the parking lots are full in high school, because everybody's practicing all the time, right? That's what I tell everybody.
That's right.
So the more you do it, the better you're gonna get at it. In the beginning, we want you to dilate just prior to intercourse. And this is why getting your partner involved in dilation is so imperative, because it makes him feel like part of the process, so it doesn't make dilating before intercourse seem awkward. Now if you're single or you're moving on to a partner after you've had one here and you're moving on to another one and you don't want them to know that you have vaginismus, I'll give you tips for that later on. But right now, this is if you have a partner and you're progressing towards intercourse. You're going to dilate for about 15 to 20 minutes prior to attempting penetration. You're going to draw on everything externally and your outer course that has worked for you up until now. You're going to remember that. I want you to touch each other. I want you to kiss and hug and make out a little bit while that dilator is in place. We don't want it just to put it there and kind of hang out. So whatever you've done, this is where sensate focus therapy that we discussed on the second day is so, so important. It's taking your body parts and learning where each other's arousal zones are. So when you're dilating together, you can touch his body parts, he can touch your body parts, you can use textures, you can use temperatures, you can use different firmnesses of objects, you can use your hands. Focus on little parts at a time. So while his hand is on your hand and you're inserting the dilator, have his hand on your thigh and stroking it. See if that relaxes you, calms you, or even gives you a little bit of a turn on. Have him stroke your hair, or focus on each other's chests, arms, hands, legs, feet, whatever works for you. You can easily look up sensate focus therapy online, and they'll give you tons of ideas. You can use ice cubes, you can use silk, you can use cotton, you can use flannel. Anything that tantalizes the senses is what that sensate focus therapy is based on. It takes a woman 21 minutes to reach full arousal and full lubrication from the onset of the sexual experience. It takes the man 7 minutes. So this is why we tell you to dilate for 15 to 20 minutes so that you've reached that full arousal. Now you're not going to reach full lubrication state because we've inhibited that while the Botox is active for that 3 to 4 months. We've kind of inhibited that, so you need to make sure that you take on that extra lubricant. As soon as you've reached that point where you've dilated prior to attempting intercourse, the second that dilator comes out, we want you to dilate to his penis size or just a little bit bigger, whatever you're comfortable with. We want you to remove the dilator and then insert the penis, minimal tip only. Now this is going to take a lot of restraint on his part. He's going to have to just kind of hang out there and let his partner be the guide. So you need to let the man know how far he can go in and if he can move. Those first couple of times, he may only be able just to get the head in and be a little ways in and just kind of hang out there. Helping him maintain erection at this point is very key as well. So don't forget that your hands can get involved in this process. So you can touch your pelvis, which will help him. You can stroke the shaft of his penis to help him stay erect in this state. If the man is a little bit inhibited because you have had negative sexual experiences up until now, it is not uncommon to have difficulty achieving and maintaining erection, so it's completely okay. Don't forget just to call us, completely private, and we'll call you in a prescription for either Viagra or Cialis if that's what you need for help. But we want you just to hang out in that area. Let her get used to actually having a penis as penetration. The penis in its erect state is going to be more malleable and more soft than the dilators have been, so it's going to feel differently. And then graduate in just a little bit more, a little bit more, a little bit more. Make sure you achieve full penetration comfortably, without discomfort and without fear, before you attempt thrusting. Now, lots of our patients report that this little clitoral stimulator that I showed you earlier, or a vibrator of some sort, which we will get into toys at the very end because it's a lot to absorb, that this actually helps them using it on the clitoris to distract them. And it's at this point that I want you to remember that the clitoris isn't just the little joy buzzer that you see at the top. The clitoris is actually about 17 to 15 centimeters long, and it's in the shape of a wishbone. What you see at the top is actually the top of the wishbone, like if you were looking at a turkey wishbone. So that clitoris extends down into the vagina. The woman's vagina in its aroused state is going to get like bubble wrap. All the nerve endings, all the blood vessels, everything comes to that vagina and makes it like bubble wrap. So it's going to feel differently to her once she's aroused and differently to you. The clitoris is to the female what the penis is to the male. So the clitoris actually becomes engorged and erect, and it surrounds that bubble wrap and it kind of squeezes it together. So you need to give her time to adjust to that. Now ladies, as he's gone from the minimal tip only the couple of times, and now you're a few times down the road, and you're adding in full penetration and you're starting to think about thrusting, your vagina will actually contract around that penis, and that's perfectly normal. What we don't want is painful contraction. You need to have a leap of faith and take a deep breath and make sure you can differentiate between normal tonus contraction and painful contraction, and don't get scared right away that your vaginismus is racing back.
We're speaking about minimal penetration the first couple of times, first 1, 2, 3 times. So we're talking about minimal penetration, no intercourse, and that's something that we have reviewed with you. And it's something that we emphasize to the men because this is an important transition for the women, and we need to do everything we can to reduce the anxiety that will still be present for that part of it, because now we're introducing something new. However, my patients become wonderful advocates for other patients. And we see this all the time where a patient says, oh, you know, I'm ready to have intercourse, but I'm afraid. And then we get the troops together, and then the troops start writing emails to the patients. It's really great. And a lot of the patients actually will dilate for between 1 and 2 hours before having intercourse. Now, that's kind of interesting because when patients dilate for that length of time, for 1 to 2 hours, then you can take the dilator out, and the patients say it's just a 1-2 movement. The dilator comes out, the erect penis goes in, and that's it. And then they're so stunned that it didn't hurt that they're actually checking around, and yes, it's in.
Yes.
So in that kind of a situation, we do have a number of patients that have had full penetration because it just slipped right in, just like the dilator slipped right in. But that's the point when the man has to have a level of control because the woman is not ready for thrusting yet.
Correct.
And so it's going to probably be another 2 or 3 times. And then for the men who should be watching this video, just take it slow. Maybe the first time, maybe after 2 or 3 times, maybe a little light thrusting, a little bit soft thrusting. And it's going to be a while before the average woman with vaginismus can really be comfortable with full, hard thrusting. The man needs to be thrusting hard because he needs the friction to ejaculate. But that's not what the woman wants at this point in time, and that's why everything has to be moderated accordingly.
And to be a little sensitive to the men who are watching this video and the partners, that her vagina isn't going to feel the same to you now while you're going through this mechanical exploration, discovering phase together to achieve intercourse. So you're going to feel that urge to thrust a little harder, and even thrusting harder is not going to help. So you need to have an exit plan for both of you so that you have a very rewarding experience. Even with the minimal tip only, draw on everything that you guys have drawn on that you could do with your outer course externally to make sure that this experience is comfortable and rewarding for both of you. Sometimes they get so excited that you forget, but once you've achieved penetration, and no matter what step you're in, until you can reach a happy, comfortable state of thrusting where he can actually ejaculate, you need to make sure that when you're done with the penetration, or you're done with your experience of the penetration, that you guys can, for lack of a better term, finish each other off. So her tone is going to be interfered with a little bit with the Botox, with the extra lubricant, and with the dilation while you're going from minimal tip only to full penetration and working up towards thrusting. So what you need to remember is it's not always going to be that way. We will help you graduate, and you will graduate together to a more normal tone where you'll feel that friction upon entry, and you'll be able to feel the friction with the penetration, and you won't have to work so hard for it. But right now, don't forget that you have 2 hands and lots of other things that you've used up until now to be comfortable with, and it's not failure, it's just completing the sexual experience, because very few people can reach mutual orgasm with penetration alone anyhow, so it's just making it a full embodied experience for you.
So I think what Ellen is saying is very, very important, because in the beginning, there are no bells and whistles. In the beginning, I would say practically all of my patients do not experience orgasm.
Correct.
The first several times that they're having intercourse. They're just happy to be functional. And the bells and whistles, the fun, that's going to come later. Right now, we're working on becoming functional. And actually, for a person with a decent libido, that process actually goes pretty fast. But let's take it now to a person who has a little bit less libido. Let's take it into a relationship where there have been some relationship issues, as some of my patients will have, and therefore do need continued counseling with a therapist for relationship issues. And they're complaining, Ellen, it just feels mechanical. It just feels like we're not making any progress.
I send them right back to sensate focused therapy.
Right.
I usually find, and not to be hard on you ladies, that it's more the woman whose expectations are a little higher. The guys are on that continuum that you've heard me talk about 1,000 times, where their sexual contact lives on a continuum. They're happy at this end, which is the low end, they're happy in the middle, and they're happy at the high end. As long as they're naked with a chick and they live most of their life in the middle, they're good. So they usually have less expectations than the women. And the women, it's usually the more controlling ones, which I am one of, so I completely understand. And you have to learn to relax a little bit and go back to that sensate focus therapy that I believe so much in. Maybe wear a blindfold, maybe close your eyes and discover where your erogenous zones are. Are you going to be turned on all the time? No. Women have a hormonal cycle that lasts the whole month long and is on a continuum itself. So there are going to be heightened arousal times, there's going to be lower desire times. We don't want you to feel like sex is a burden and that it's mechanical all of the time. So you just need to find that happy medium together, and maybe you have a dilation session where you are naked without the expectation of intercourse and you practice as sensate. Maybe it's focusing on the breasts for that one, or the ears, or the hands. Maybe it's a nice sensual massage while she has the dilator in, guys, so that you let her know you're in it just to have the experience with her and not necessarily need the actual penetrative experience, so that you guys can learn to bond together. If you're still struggling with it, please just call us or email us. If we can, we'll get you a referral in your area, or we'll help you work through it bit by bit. But it's really just going back to the basics, 101, remembering guys live on that continuum, girls, and only a single-digit % of women can experience a penetrative orgasm. That's why the clitoris is so big. That's why there's so many erogenous zones. That's why you need to make it a full-bodied experience and grow together.
As part of the sensate focus, I mean, there are two different parts to sensate focus. There's sensate focus that's non-erogenous, and there's sensate focus that can be erotic. And most of the time, couples don't spend enough time discussing with each other the sensitive, feel-good parts of the body. I mean, with sort of guesswork. But if in sensate focus exercises, you're actually touching the various parts of the body. You're actually touching non-erogenous zones, you're touching erogenous zones. And then you're communicating what feels good, what doesn't feel so good.
And for a woman, it's not just touching her body and about her body. It could be the dishes aren't done, the laundry's not done, the house isn't picked up. So a woman is a full emotional and full environmental aspect and
Right.
experience, where a man is very focused physically. So you guys really need to talk, because it could be something as easy as, I'll give you my example because I like to give examples myself. My husband was like, how come we don't do it like we did it before the kids? I'm like, how come you didn't hire a maid? Because I have to clean the house when I come home and then I'm tired, right? So then I'm just like, okay, let's do it real quick and get it over with. And it was more of a duty. So next thing you know, I got a housekeeper, and that freed up a lot of time. So it's little things like that that a woman will respond to, because it's not just her body physically. She definitely draws on sexuality through her environment as well,
Right.
and emotions, much more than a man.
Right. So for the guys listening, it's not just about bringing home the flowers. It might be about doing the dishes.
Right.
You do the dishes, that's a big turn on for
Or
your lady.
making the bed, or even washing her hair in the shower and not expecting anything in return. It's really just learning to grow and enjoy each other on a mutual basis, without expectations and without that it has to end in this, because you will achieve it more often if you're having the full incumbent experience.
The other thing that we should talk about is that the Botox lasts about 4 months, sometimes as long as 5 months and sometimes as short as 3, but 4 months for the most part, that's how long the Botox lasts. During this period of time, the Botox not only interferes with muscular contractions, it also interferes with a woman's letdown. And this is very, very important. It interferes with the parasympathetic nervous system, which governs letdown. And so lubrication is very, very important for those 4 months. And the lubrication is also very, very important transitioning into intercourse. And patients ask me all the time, how does Botox interfere with my normal functioning? Well, the woman will probably feel reduced vaginal contractions during orgasm. And once the Botox wears off, then the vaginal contractions will be more, there'll be more of a letdown, but the lubrication continues to be important. One of the things that we didn't discuss is that intercourse is not a substitute for dilation.
Oh yeah, I was going to go back to that.
Yep, so let's go into that right now.
Can I finish with the natural letdown and
Sure.
describe the orgasm?
Yes.
So when we say that it's going to feel mechanical and practice makes perfect, this is for both the men and women. It is going to feel differently once that normal vaginal tone returns after the Botox is worn off, and your orgasm is going to become more intense. So it's very difficult to achieve a penetrative orgasm alone for the women, because they need G-spot stimulation and clitoral stimulation, both internal and external. Well, your clitoris goes around the inside of your vagina, like the wishbone, turkey legs down in. Your G-spot is just inside anteriorly or on the front of your vagina. So unless your penis has a curve like this and can do that like an inchworm, you're probably not going to stimulate everything at once. So paying attention to her vaginal area and her clitoris externally and internally is going to help her achieve that orgasm. And then whatever else excites her, whether it be her breasts or her ears or her neck. I had one patient who was like, man, I really like it when he grabs my knees. I was like, great, whatever works for you. And for him, he's going to feel that tone. It's going to be a little tighter for her when the Botox wears off, and it's going to be a little tighter for him. And he'll be able to feel the stimulation. You can do Kegels during penetration to help increase his stimulation and yours. But when you're having a penetrative orgasm, now that you have something in that cavity, in your vaginal canal, you're stimulating the clitoris all the way around. Your urethra runs right along the top of your vagina, and you have 2 ejaculation ducts that run alongside of that. Once that Botox is worn off, you may feel more wet, and you may feel a contraction during that letdown and during that orgasm. And you may even feel a tad bit of, I'm going to describe it as cramping because it's a whole pelvic response. That is perfectly normal. I don't want you to think that the vaginismus is coming back. I just want you to know it's because your vaginal canal is full. And when we cautioned you about dilating and hitting your cervix, I don't want you to worry about hitting your cervix with penetration because the penis is malleable in its erect state and it's meant to kind of slip around your cervix and be comfortable. If your partner is excessively long, however, you may feel it and feel discomfort and just have him back off a little bit on his thrusting. But if you can just take a deep breath when you start to feel that full pelvic contraction that you will have with a full internal orgasm, and remember me in the back of your head, you won't cheat yourself out of it. You may feel the need to urinate, that's okay, just go with it. Believe me, you are not going to wet yourself. Most likely it's because those ducts that run along your urethra are all swollen and they're squeezing the urethra. If you pay attention to what it is, whether it be a small amount of fluid or a large amount of fluid, I'm betting that it's going to be very clear to milky and a sweet smell versus the actual smell of urine and very thin and silky like that. And just have a leap of faith. Try it a few times. Everybody has a different level of wetness.
This conversation is obviously easy for couples. And a little bit more difficult for the single gal. And we certainly have had lots of single women come through the program. We've even had some women who lost their partners shortly after the program. My own recommendation is that a single woman really doesn't need to discuss her vaginismus. A single woman can still use a dilator ahead of time as a toy. And our women who have been successful where they've had new relationships usually don't discuss their vaginismus ahead of time.
No, they don't. And we skipped a little bit. The penetration is not a replacement for dilation.
Yes. So let's continue with that because we can always come back to dilation anyway as it continuing to be important with intercourse.
So this is where alternate dilation methods really come in handy, is for the single person.
Yes.
Because they can get used to penetration without a partner. Now we've had a few couples come down and then they've broken up before they've actually had intercourse, but the next partner for the woman has never known. So there's a few tips that you can do. You can practice with the dilators or with additional dilation methods, which I'll show you some when we go through the alternate dilation methods and the sex toys. I'll point out which ones are very beneficial to the single gals. I usually tell them when they can insert the pink or the blue easily without concern, then they can kind of adjust their dilation schedule a little bit and maybe skip a couple days here and there. The single girls that have moved on to partners that their partners haven't known, these are the tips that they gave us. They kind of sized them up in make-out sessions before they were in a position where they would have intercourse with them. So they knew what level of dilation they had to achieve. They would pre-dilate before they went on their dates or wear a smaller dilator while they were on the date, either out to a movie or dinner, and then just excuse themselves before intimacy to remove the dilator. So there are other choices that you can make. You can practice the movements with a dilator or with the alternate dilation methods. No partner's going to complain if you decide you need a clitoral stimulator to kind of distract you. And then all you have to tell them is that, you're not very experienced in this and you'd really like to take your time. And if they're worth it, they're going to be sensitive to you and they're going to help you through that. But those are the easy tips. I don't want you to think that you have to tell every single person. Some of our single couples have gone back to boyfriends that they have broken up with, that this was an issue in the past, but they still had a good relationship as a friend with the boyfriend, and the boyfriend has volunteered to help them discover their level of penetration per se or act as a surrogate in their life. And there's just many, many things that you can do by yourself. And what happens behind your closed doors, whether you're a couple or single, happens behind your closed doors. You don't have to tell anyone about it.
Well, why don't we continue with with intercourse not being a substitute for dilation? Because
Okay.
that would really apply to whether you're single or whether you have a partner.
Right, so once you've achieved full penetrative intercourse and you're thrusting, intercourse is not a substitute for dilation, excuse me, because it is not frequent enough nor is it long enough. So when we say that, we say you kind of have to play with your dilation schedule. Once again, no cookie cutter recommendation. We have one patient who sleeps with the pink every single night except for during her menstrual cycle because that's her comfort level. We have another patient that dilates 2 hours a month, and that's her comfort level. Usually we find that after you've achieved intercourse and the Botox is worn off, and say you're right around 5 or 6 months, well, once in a while you get that little email that says, I think it's coming back, I had some stinging or burning the other day, it was a little more difficult to have intercourse. First thing we ask them is, when's the last time you dilated? It's usually, oh, I don't remember. Because it's not frequent enough and long enough, you do need to kind of play with your schedule a little bit and see where you fall. It could be an hour a week, it could be 2 hours a week, it could be sleeping with it every couple of nights. You just gotta play with it and find that comfort zone. If you continue to keep a dilation log and you ever run into problems, we can kind of read that and help you out a little bit more. And that's my best recommendation because, do you have anyone's?
I do. I think that what's important I think if we were to look at a fairly large series of patients, I mean, we're doing this tape now, it's just early December, December 5th of 2011, and we've treated now approximately 140 patients. And I think that we're just getting the feeling that for the most part, patients need to be pretty conscientious about their dilation schedule for about 1 to 2 months.
You become really good friends with your vagina.
And that's right, and your dilator becomes your best friend. After that, it's variable. Some of our patients need the schedule of dilating to stay comfortable, and some of our patients are able to dilate less. We have patients that dilate 10 or 15 minutes every day or two, and they continue to do fine for the rest of the year. I generally recommend dilation for about a year because we don't want patients to regress. We do recommend sleeping with a medium dilator every second night for about a year so that patients don't regress. But after 1 or 2 months, this is where there's a divergence among patients, where some patients will do well with less dilation, some patients need more dilation. So how do you know which program is the best for you? The way you know that is if you start having discomfort again with intercourse. The very first thing you need to do is reach for your dilator, get back onto your log,
Your dilator or your dildo.
And begin logging in the amount of dilation that you're doing and start increasing that again so that that is going to be the first line of defense then in terms of starting to have discomfort. And I might add that some return of discomfort is more common in our secondary patients than in our primary
Because
patients.
they usually have more issues of lubrication or menopause or post-cancer radiation, things like that.
Right.
So it is more common, and we kind of just have to play with it a little bit more, but that doesn't mean you're going to be less successful. It just means it takes a little bit more time to adjust. Another thing I want to go back to though is if you're having a little bit of an issue progressing towards intercourse and you just can't seem to give up control to allow him to have penetration, there's no reason why you can't insert the penis yourself, or you can't let him try 1 or 2 finger insertion gently and slowly so that you can get used to his touch and you can trust him. He's not going to complain if you kind of treat the penis as a dilator, and allowing him to put a finger inside may allow you to trust him a little bit more that he's going to listen to you. So I wanted to throw that in there too because
Sure.
I thought of that.
And what we should do is we should speak about some advanced dilation techniques, because we had the pleasure of a physical therapist visiting here, and she, in her own um, program, advises that couples routinely use 1 or 2 fingers to just help stretch the dilator. So this is what a physical therapist would do. A physical therapist actually stretches the vagina with the fingers. And this is something that can be done by yourself, or your partner can do this for you. And that's all part of the progress that you're making.
I kind of smiled because the girls tell me that Dr. Pacik's finger stretch like this scares them when he does that. So you can have your partner insert a finger and you can do it like this as well. It doesn't necessarily look as,
All
they say
right,
that
well,
looks
I
more
think,
like you're pulling
I'm going to
peace
stop
into-
counseling my patients that way. That's a very good idea.
I actually forgot about it till just now. But you can actually have him insert fingers and do a nice gentle massage. You can do it yourself, and you can get the full circumference that way. You can also use glass dildos that we'll show you later. They have a nice heavy weight to them, and they can do that massage for you. But definitely those are advanced dilation techniques, and I think it's really our secondaries that need a little bit more stretching and massage
Right.
because they have a little more atrophy.
I think that's true. I think that usually the primaries, they just, once they've gone through the dilation process, and once they're having intercourse, they don't really need a whole lot of advice anymore after that anyway. But we should, before we continue with, I know, your favorite subject, and getting onto the
Plenty of
glass
time.
dildos, why don't we speak about positions of comfort? Because I think positions of comfort really is germane to this conversation.
So that's a good time for the books as well. That's why the Karma Sutra was written. There's no, this is the way intercourse has to happen. So back to, we told you to dilate in different positions. Remember what works well. Try a different position to make intercourse more fun. Say, tonight we're gonna turn off the phones, he's gonna make the bed, we're gonna take a shower, and then we're gonna try the canine position, per se, or the standing position. We have lots of books that we recommend, and one of my favorites is the Guide to Getting It On, and it has all sorts of ideas in here. There's a scissor position where you can still have full frontal, and it helps him not go as deep so that you can control it. Whatever you feel is your comfort level is what you need to try. Another book that we recommend is Real Sex for Real Women. This is Dr. Pacik's favorite, and I always say it's his favorite because it has full color pictures.
That could be true.
But this also has some very good positioning in it. If you're gonna do a missionary position per se, you may need a modified missionary position where you have a couple of pillows underneath your hips so that the pelvis is tilted up and he has a better angle with the penis, more like you would insert the dilator. You can try it on your side with one leg up in the air. They call it doggy style, but I like to call it canine. You can try it with pillows underneath your chest and kind of a modified one so that you can relax. We had some of the girls report that they preferred their partner to either be sitting on the bed or in a chair, and they kind of mounted them per se because they could control the depth the first few times, and that's the position that they felt most in control with. So just talk to each other, make fun of it. If you can't laugh at yourselves, then it might be a little harder to get through it. So just remember that there's going to be some funny noises, some funny moments, some awkward positions, and even to this day, after 13 years, I'll say to my husband, "What was that?" sometimes, and we'll just kind of laugh about it. So just remember that it's a journey together, and it's an experimentation phase, and I'm going to go back to high school. That's why the parking lots and, the locker rooms after football games, stacked busy.
Okay, great. So there are, though, we should discuss very specifically some of the different positions, the pros and cons of that. For the woman who wants to maintain control, woman on top position is one that's going to maintain control. And if you know that you like to maintain control, you could even practice dilating in that position. So you can practice dilating standing, or dilating in a crouch, and dilating that way.
Or on your knees on your bed.
Now, the problem with the woman on top position is that sometimes there's too much penetration. So though you do have control, the penetration will be deeper once
It is the deepest.
full penetration is
Yes.
done. There are positions of pelvic relaxation, and the positions of pelvic relaxation would be being bent over two pillows that relaxes the pelvic floor and being entered from behind, and that is a position of relaxation. Another position where the pelvic floor is relaxed is spooning side to side. That's a comfortable position.
The face-to-face scissors.
And say that again?
The face-to-face scissor, which is kind of like spooning, but your legs are scissored.
Mm-hmm. Okay, why
That's
don't you describe, why don't
relaxation.
you elaborate on that, because a lot of the patients may not be familiar.
So if spooning, because some of the women prefer to look at their husband or their partner, they're not sure if he's gonna listen to them unless they can see them. You can get that same relaxed position from the rear spooning position and a frontward scissor position. So your legs are kind of like this. And so one leg is draped over his leg is usually up in the air like this, and then she can come in from the side. And it doesn't allow it to go very deep for the penetration, that doesn't allow deep penile penetration, and you can really control it and allows her to move around him a little bit easier.
So what else would be, we talked about the different positions of comfort. So, and then of course, you know, you have the missionary position. The missionary position, which is the traditional man on top position, is comfortable really for many of our patients. And again, I think what Ellen said, I'll second that, and that is just to keep experimenting. Try a lot of different positions. Take a look at the Laura Berman book. They have a lot of positions. Certainly the other book by Paul Janitis that has a lot of information in there. And again, it's just an experimentation. You're growing together, you're experimenting together, and you're learning what works and what doesn't work, and what's
Just have
comfortable.
fun with it and remember you're on that continuum. You'll have peaks and valleys throughout your sexual journey together. That's completely anticipated and normal. Just embrace each one of them, whether they be a valley or a peak, and know that it makes you who you are as a couple.
I think we also should speak about the importance or lack of importance of orgasm. For the male, very often the female having an orgasm is important to him feeling that the lovemaking was successful.
And then for her, just completing the task and making sure that he reaches orgasm and ejaculation is satisfactory enough sometimes.
So this is all, very few couples orgasm simultaneously. I think that there's much too much dream literature on simultaneous orgasms.
And it's all over daytime soap opera.
So, you know, the dual orgasm is great when it happens, but not necessarily a sign of success of a wonderful evening or morning or whenever. So those are all things that just need to be modified in terms of the thinking of going having the intercourse. Okay, so Ellen, I think that at this point in time, why don't you show some of the wares and toys?
Well, this is usually the question answer portion when you're in the office, but we'll just go right into toys because we don't have anyone here
Right.
for question and answers. 2 more books that we highly recommend, and if there's, I don't want you to think that reading a book is failure or that they're dumb or anything either. I have read so many sex books in my life that I've drawn a little piece from each of them, and just call us, send us an email, let us know if there's something you're struggling with. We'll be happy to give you, because there's many more advanced techniques to dilating, intercourse, pleasing each other. We just want you basically with this tape to remember what we said while you were here the second day and go from mechanical to functional, and then if you still need help beyond that, just give us a call and we'll help you achieve that as well. But there's Women Who Love Sex by Dr. Gina Ogden and The Heart and Soul of Sex, and these are 2 excellent books. I think they're a little more for the maturity level, depends on your relationship. Women Who Love Sex, I would recommend for any age, but The Heart and Soul of Sex really definitely takes a mature outlook to appreciate and understand. So I'm going to show you things not to use, just like we had it in day 2, and things that would be beneficial to use. So one of the biggest questions we get is, my partner's erection, you know the standard dilators that we use, and we ask you here when you're in the office, but on occasion we have a partner that is larger than this blue. That does happen. My partner has a curved penis. My partner's penis is abnormally shaped. It's thinner at one end, thicker at the other. There's no abnormal penis, it's just what his is. Sometimes they can be a little daunting, they're not always pretty to look at, and they can be a little scary. We do have what we call the Mr. So Real that we recommend for a 7th dilator if you need it. It is slightly larger than the blue dilator, believe it or not, just by a little tiny bit, but it's aerodynamic and ergonomically correct because it's anatomically correct. So it has the shape of the head of the penis, and it's malleable like an erect penis. You can use this as a dilator. If you need something even larger, which few people do, and if that's you, there is the make your own dildo kit or the Clone a Willy. Now this isn't medical grade silicone, but it will work to dilate, and it is a fun activity to do together. You actually make a cast of your partner's penis, and then you can make a dildo out of it, or a dilator, as I like to call them. It can either vibrate or not vibrate, and that's totally up to you. We did have a patient who he had a very thick base of his penis and a slight curve to it. So he actually made a cast, and it made her feel more comfortable because once she could dilate and insert that fully, then she was ready to move on to intercourse. And then some of our larger patients. Now, if you are significantly larger than the blue, and we've discussed this, you may need 2 kits if this is the way you're going, or you may need the larger Mr. So Real that actually gives us a much larger diameter around here. So just, if you're at that point now and you didn't get it when you were here, just give me a call and I'll help you out. What I don't want you to use are these hard plastic dilators that are usually the most appealing because they're inexpensive, they're strong in their dilation, kind of sounds like a lawnmower, or their vibration, not their dilation, excuse me. These aren't going to do well over time. They have a seam that you're going to get bacteria in, so it's going to be harder to clean and harder to keep clean, and it's not going to smell good or look good after a while. They also have seams at the end that can be scratchy and cause some irritation in the vagina. When I described that bubble wrap back when we were talking about penetration and arousal, that bubble wrap can get little micro tears in it if you're not properly lubricated enough, and then you introduce something that's scratchy and has seams, and you're going to get those little micro tears. Not the end of the world, but it will be uncomfortable for a couple days, and it'll be a little stingy after intercourse and not be your best friend.
I would like to interject something for a moment. Let me have Mr. So Real back.
Sure.
So I'd like to interject 2 things. And it's really good that Ellen and I are doing this together today because there's just so many things that we discuss during the counseling, and actually sometimes we probably forget a few items anyway. As far as the Mr. So Real is concerned, this comes as a lot of different sizes in terms of the actual width of the artificial penis here. But we're not quite sure about how good the rubber is.
It is not medical grade.
It's not medical grade silicone, and so therefore we recommend covering this with a condom, just because we're just not completely sure about the rubber. And the other thing that this reminded me of is we tell all of our patients that an erect penis is more comfortable than the blue dilator. I'll take that blue dilator for a second. So the blue dilator, although it is silicone, and although it is soft, it's not as soft as Mr. So Real, and it's not as soft as an erect penis. So patient after patient will tell us that an erect penis is more comfortable than the blue dilator. Nobody believes us.
I'm telling you.
Until they actually experience it, and then they know that to be true. And that's something that you might just factor into the anxiety of transitioning to penile penetration is that this is gonna be more comfortable than.
We actually have one husband right now who acts as the dilator for his wife. They haven't achieved full penetration yet, but he actually, can I see Mr. Silreal real quick too? He actually becomes erect and keeps his erection by using his hand and stimulating his testicles, and he hangs out inside of her just halfway because she wants to dilate more, doesn't necessarily want to have intercourse, but she is definitely not comfortable with the blue. I forgot an important part of Mr. Silreal, and this is usually the fun part, and if you remember when you were in the office, he also sticks to surfaces because he's a suction cup, so you can attempt different positions, whether you're single or in a relationship, by putting him on different things because he will suction cup. Sure. That's my fun part. So that old hard dilate, or that old hard vibrator that I said wasn't good to buy, if you've used the vaginismus.com dilators, it's the same plastic. So just so that you remember, it's just not going to be comfortable. It is, however, not bad for external stimulation or using it as a trigger point or something like that all over your body, but it's not very private either if you live in a house where you're trying to keep things quiet, because it does sound like a lawnmower. Don't get sucked into the couples things. This is called a dolphin, and it's sold for couples so it can be stimulating to her and him and prolong the erection. They really don't work. Number one, a erection prolonging ring, or also known in the industry as a cock ring, has to be wide enough to go around at the base of the penis and the testicles. So there's no way you can stretch something like this to go around to actually increase your erection length time and sustaining it. If it only goes around the shaft of the penis, all it's going to do is annoy him, chafe him, and cause a sore at the end. It'll also cause him to be numb if this rubs on his testicles, because these little magic bullets, you can hear them, they sound like a snowblower, and they kind of jump around, and they're very, very strong. They are, however, great by themselves in a remote control to be used all over your body and as a clitoral stimulator. But don't forget, these are not what they're cracked up to be when they're used on one of these joint toys. And this is actually a nice grade silicone. However, because of the finish that's on it, it causes flaking. And I'm not sure if that's the silicone of the actual toy or the lubricant, but these toys have all been cleaned. So you just gotta be careful and don't get roped into those. If you wanna look for a different dilator and a dildo is not your choice, there is a set from the Women's Clinic of Women's Touch dilators that I can hook you up with as well. They have a slight curve to them and they're more malleable. However, this is the largest one. So this is in between the pink and the blue size, and then they have a couple of smaller ones that we have right here. But they do have a nice curve to them. They are nice and comfortable, and they're a medical grade silicone. Dr. Pacik is currently developing some glass dilators because glass is very smooth and slick. Can also be used for sensate focus because it can be warmed and cooled. And these are short and ergonomically made for the vaginal area so that you can wear them around more comfortably. Right now, this one doesn't even look like it, but it's in between our purple and our pink, just slightly. So we are trying to develop these and have them available for you. Hopefully by the time the tape is out, we'll have more of them. Now, for the single girls, I'm going to show you a couple of vibrators or dildos per se that really will help you move on and progress towards intercourse and kind of practice by yourself before you go on to a partner. This is called a pearl. It can be purchased with or without the clitoral stimulator on top, but it has some actual soft pearls in here. Now it's going to make a movement where you can insert this. And this only sounds like a little weed whacker, so we're going to get to quieter ones as we go. But you can actually insert it and practice this movement and just let it hang out. It will do the massage of your vaginal muscles for you. You can go different directions and different speeds. and you don't have to have any thrusting with it at all. But I have had a few of the single girls buy these, and they say they're very, very comfortable, and it kind of gets them used to what's going to be happening when they have intercourse. So it just kind of hangs out, does the massage for you. If you buy it with the clitoral stimulator on top, then you can actually have an enjoyable experience and possibly have an orgasm while you're dilating, and it can either vibrate or not vibrate the little stimulator on top. And it's a little quieter than that mechanical round way. There is a set of toys that we do carry called the papaya toys, and we do get these at a discount that we can pass on to you. Not everyone can do that. They come in a nice box, so nobody even really knows what it is. There are 4 different kinds, and I'm going to explain why some of them are better, and we do have all 4 kinds to show you. These are medical grade silicone. They're actually better than the dilators we use as far as silicone. They're very, very quiet to be used, how you can barely hear that one, and they have 3 speeds. They can be inserted as a dilator, used as a toy to practice thrusting, used as a clitoral stimulator. You can actually switch ends, use these ends as massagers when you're doing your sensate focus therapy, use them on other areas of the body. You can actually stimulate him underneath the testicles because it's not a very strong stimulation on a couple of the options. The only thing I want to caution you about is when you use them is that because you have vaginismus and we have those tight muscles that we're trying to get through, especially that bulbal cavernosum is, and I'm going to show you all 4 of the styles that they have together to help make this point, is that if you have one that has a notch and doesn't have a unisome size going down, you can actually, when you do dilation, slip past your bulbal cavernosum and then it'll still be tight around it if you don't have it in far enough to maintain that equal distribution of dilation. So when you're looking at toys to do that with, you need to be careful. The one that was penis shaped with the clitoral stimulator on top, this is a uniform shape and it'll do massage. So you really have to be careful. Out of the papaya toys, and I've had the pleasure of being able to try them all, the ones that don't get caught on your bulbal cavernosum are the one with the twist. Again, medical grade silicone, very nice, very quiet, multiple speed. Also has a patented battery pack that you can put in inside down, right side up, upside down. So if you are further along in your sexual experience and you're in a hurry to change it, you can. And it is also waterproof, so you can use it in a hot tub in the shower. It has nice texture to the outside to be used as a massager all over the body. So there's that one with the twist, and then the pink one with the swirl has the least amount of taper so that you can actually have an even dilation once you get it inserted. And then they have this one that's more like a tulip, and it has a taper off. So if you reach a point where you're comfortable and you want to feel that notch in and out, okay, but in the beginning I would say try to stick to the more uniform shapes.
I think what we're also discussing here, so often our patients will say to us, you know, I'm ready for some advanced techniques.
Yes.
let's move beyond the dilators and let's move, you know, and we get this all the time, you know, a lot of our patients are sexually underdeveloped because they just haven't had the experiences. But once they get past the dilators and they're comfortable having intercourse, a lot of our patients want to explore with different things. And I think one of the great things for a couple like this is to go together to a toy store, go together to a sex store. They're fun. I mean, it's a quantum leap struggling with vaginismus.
Even if you don't buy
And then,
anything, just
yeah,
go for the
and
fun of
then
it.
going a few months later to a sex store and just looking at all the lingerie and the gowns and the films and all the different things and just laugh about it. It's a great evening out.
So this purple papaya one, and this is German technology and engineering, is actually the same size as our blue and graduates up to a little larger down. So it can give you that larger than a blue. Sometimes our patients also ask us for alternate methods because these just aren't sexy anymore. And they want to do some sexy dilation, and they want that clitoral stimulant, and they want to feel it. The other little subtle difference to this twist is that if you are using it to dilate prior to intercourse and as a sex toy at the same time, it has a slight curve, so you get G-spot stimulation with the twist of it.
So we've talked about the G-spot a little, we've touched on it a little bit. And the G-spot is a little bit ephemeral, and we're not exactly sure where the G-spot is. It tends to be a little bit different in different women. It tends to be located more towards the front, what we call anterior. So more towards, you have the back and then you have the front. So along the front of the vagina. And it probably is located approximately 1.5 inches or so, but it varies among women, and there are probably plenty of women who don't have a G-spot. Beverly Whipple actually is the psychologist who developed the whole concept of G-spot, and she has books. So Beverly Whipple, if you want to do more research on G-spots, she wrote the book on G-spots a number of years ago.
So that's a good point, that not everyone may have a G-spot, but it doesn't mean that you can't enjoy something. Now, if it was just a G-spot stimulator that kind of looks like a finger and goes in like a J-hook, those would be totally off limits. But something like this would give you full clitoral wall stimulation too of the legs of the clitoris. So whether or not you had a G-spot, it's still beneficial because it has just that slight curve that if you go slowly enough, you pay attention to your body enough, and you do the Kegels with it, and it's a full embodied experience. Once again, I can't stress that enough, with your partner or without, you can actually feel the full stimulation. Glass is one of my favorites. This is one that I recommend. I know you're going to say, but it's not long enough on the end. This is because the weight of it is just enough that you can massage the bulbo cavernosum, and it does most of the work for you. Because it's glass, again, it can be warmed and cooled. You can use it on different parts of your body for sensual massage, for your sensate focus exercises, excuse me. And you can do the refrigerator for these, for the girls that are experiencing just a little bit of discomfort and a little bit more irritation, swelling. The coolness effect of it right out of the refrigerator is good, and you can actually feel it warm up. And it will do some of that physical therapy on your bulbo cavernosum itself because of the weight of it, just nice and easy and feel good. This end right here is actually just under our blue size, almost equal to the tip of our blue, as you can tell. This end is in between the pink and the purple. It does have graduations, but it can still do some of that for you. And I know you're going to say glass, it's not going to break. When you were here, I threw it on the floor, it's not going to break. You can put it in your dishwasher, you can put it in your oven, you can put it anywhere. It's the same tempered glass that Pyrex uses, so if you can break a Pyrex, I guess you can break this, but the chances are it's going to last a good long time. This one is actually called the blue icicle. I mean, you can hang it on a Christmas tree. Your mother-in-law would never know what it is. So this is a glass dildo that I have actually developed specifically for vaginismus patients, but even if you don't have vaginismus, this is just our prototype, so it is changing a little bit. But this is the basic gist of it. I had this in designed like a bullet, like the mechanical bullets that I had shown you, so that we have a more even distribution of dilation and a better therapeutic response. This end is actually going to be in between our pink and blue sizes, with the middle of it being slightly larger with a little bevel. This end is in between the purple and the pink sizes, and it's a twist because what I noticed is when I watch our patients dilate, they actually kind of twist the dilator in sometimes. So I wanted them to have that therapeutic feeling on their bulbo cavernosum of this twist, and it is a nice, soft, smooth twist. And I wanted you to be able to have that if you were using it during arousal prior to intercourse, or not even with anticipated intercourse. I wanted you to have that even distribution and massage of the clitoral legs as well. I wanted to make dilation fun. Then you can switch it to this end when you're ready to progress a little larger, and sometimes it's easier to go larger with glass sooner than it is with silicone, because once this is lubricated, it really is very, very, very smooth with no catch, where you sometimes can have the silicone. So it's more tapered at the end to allow an easier penetration, And then you can also use it and twist it in. Again, just like the icicle, you can do the therapy with it, and you can massage your bulbo cavernosum and reach them all, and you can also use it for in and out movements and practice thrusting. Again, this can be warmed, cooled, whatever is the best for you, and you can also use this as part of the sensate focus that we always, always, always go back to, and you can try it on different parts of your body, and you can massage different parts of your body. You can put it in the freezer and run it along your back. You can use it for sensual massage. You really can use it for many, many things. Same tempered glass, won't break. When it's finished, it's gonna have a nice color stripe through it, so it's pretty, and be called the handy candy, look like a little candy stick. And that's really sums
Just
it up
got
for
that
the
for a
toys.
second. So the reason that we're moving more and more towards glass is because it's so smooth.
Very
It's
smooth.
very, very smooth, no friction going in. We have a lot of different sizes, a lot of different possibilities. We have someone local here who's actually working with us with some of the design techniques, and these will be available on the website. We're just almost just a short distance away from launching our new website, vaginismusmd.com. That's vaginismusmd as in medical doctor. And then we're also going to make these available as vaginismus aids. Ellen has spoken repeatedly about the bulbo cavernosum. I just want to remind everybody that the bulbo cavernosum is the entry muscle, and that is normally the muscle that's in spasm, and it actually does look like a closed fist. Lastly, I would like to mention that in my book I discuss J. Marion Sims. So the book, as most of you have read, When Sex Seems Impossible, J. Marion Sims is considered the father of gynecology. And in 1861, he really described the first case of vaginismus. Vaginismus had been described before then, but he really developed it into a full case presentation. And the fascinating thing is that they used glass dildos as dilators, long before we had silicone. And so glass has actually been used for a longer time than silicone, and we're rapidly getting back into glass.
So speaking of the gynecological exam, whether you're pregnant or not, dilating prior to your exam is going to be the most beneficial to you. We did discuss that when you were here, so please don't forget that. You can make your appointment at any time you feel comfortable, ready to go to your gynecologist. They do recommend a pap smear at least every other year after the age of 21 or when you become sexually active. If you dilate prior to going in, you're going to find it's more successful. You can dilate for an hour, you can dilate for 2 hours, you can wear your purple dilator in. If you let us know where you're going, we'll send a copy of your treatment here and our notes that we have and Dr. Pacik's exam and treatment notes that they're well aware of what to expect. And we've had a few patients say that they actually asked to insert the speculum themselves to be more successful because it was easier for them. They trusted themselves, they just inserted it how they'd been inserting the dilator. And we did most likely do a mock GYN exam on you when you were here, if you could tolerate that, where you experienced the empowerment of inserting it yourself. So please don't forget that if you're starting to get a little bit nervous about moving towards an exam.
I would add to that just a little bit. A patient of mine in her questionnaire wrote that she would rather die than have a GYN examination. That's how terrified patients are of the GYN examination. And I think that is as big a stumbling point as having intercourse, as having the GYN examination. I would certainly reiterate, you want to dilate for an hour or two before your GYN examination. You can arrive at the GYN, at the doctor's office, with a dilator in place. And the doctor can remove it and talk to him about vaginismus and the treatment that you've had, and that becomes easier. Or ask to be put in a room 15 minutes before your appointment and just dilate up in the room. That's another possibility. As Ellen said, ask to put the speculum in yourself. The speculum, a full GYN examination can be done with a child speculum. I did the entire Botox injection program with just using the child speculum. You don't need a big speculum to be able to see what's going on, and a child speculum is about the size of the purple dilator. So every single patient tells us that they had much more fear than was necessary before the GYN examination, but the trick throughout is to dilate before your GYN examination and arrive with the dilator in place, or ask to be put in a separate room and then put in the dilator yourself.
And please remember, you're always in charge of your own health care. So if you're in an office who is not accommodating or sensitive to you and respectful at the same point, you can always shop for another office. And we have enough patients now that we're starting to get a nice network that we could get probably a personal referral in your area from a patient who has had one or something. So please remember that it is definitely your choice on who you go to, and you're not stuck with who you have, because there are some very insensitive doctors out there, unfortunately. I know you've heard this talk because you've been in the office, but some of our patients that we do dilation only via telephone and Skype may not have had the benefit. It's so smooth. I can't express how smooth it is. If you get to a more advanced point and you say, hey, my glass dildo is a little too smooth and I'd like a little resistance, you can actually get them frosted and it'll give you just a little tiny bit of resistance, but yet a silkiness with it too. The weight of it is phenomenal, once again, for massage all over the body, for that physical therapy of your bulbar cavernosum and your vaginal muscles. It's just a nice piece and looks like artwork versus a silicone dildo.
I think what I'd like to discuss for a moment, as we're just wrapping this up, is something a little bit more about advanced techniques. When I think about our counseling sessions, we really don't get into advanced techniques at all. The patients are very, very happy that they're dilating, they're very happy that they have a normal vagina, and they're happy to be functional.
Sometimes they can't visualize advanced techniques either.
Right, and it's just too soon. But this is now a DVD that's being prepared, which we're going to be giving to our patients after the counseling session. It can be reviewed as many times as they want. And more as our patients are now 4 months and 6 months and 8 months out, they want to know what else could they be doing that would be fun. You know, patients love to learn about their sexuality. So let's just wrap up the session and just spend a couple of minutes just discussing some advanced techniques.
It's that guide to getting it on, Dr. Pacik.
Guide to getting it on.
That is my
okay.
favorite. It makes sex fun. It makes developing your sexuality fun. It makes everything. I have actually had this book since, well, long time ago. We're on the 7th edition now, and I have the 3rd edition, if that tells you anything. So I have had this book for a very long time. It makes it fun, and I usually say it at the beginning of the talk, but my philosophy is behind closed doors. What happens behind your closed doors, whether those closed doors is the world, out in your front yard, your kitchen, your bedroom, a hotel room, your car, it happens. Most of your friends are lying about what they have. So the guys come in here and say, oh, my friends say they're doing it like 3 times a day with their wife and they have 3 kids. Well, that's not possible unless he's cooking, cleaning, going to work, and running carpool. Not possible. So generally it's the rule of 3. Whatever a person is saying, it's 3 times that is what they're not doing. So just remember that it's fun, it's you, it's yours. If he brings up something or she brings up something, it may not always be what you want to do and what you expect it to do, and you may think, oh, that's weird. But if it's not completely unreasonable, think to yourself, could I do this for him or for her? And try it once or twice. And it may work out to where you're like, oh, that wasn't so bad. Yeah, we could do that a few times a year. Just really explore your limits and boundaries together and communicate. Communication is definitely the foundation for a mature experience and a mutual growing experience for sexuality.
Well, I would add to that also, I like sex smart films.
Sex smart films and better sex films.
Sex smart films sexsmartfilms.com, one word. They have a lot of good professional models,
That information's in your folder as well.
a lot of information from Sinclair Institutes. They
Yes.
have some excellent films, also professional models.
And it's not watching pornography, watching an educational sex tape. I've actually even had my students that I teach watch it because I've needed to watch them for patients. So I figured, oh, we're on the reproductive system, I'll throw it in. It's watching and exploring what the possibilities are. It may be an hour movie. You may get one thing out of it. It's worth the $20 or less that you're gonna pay for it. And you may just find that watching these movies brings eroticism, not even trying anything in it. And you know, it's really communicating with each other your needs, your desires, and your wants. Because needs, desires, and wants are all three different things, even though most people think desire and want are the same thing. And really, really exploring it without inhibition together.
And I think the other thing to do is one has to identify, a lot of people are very visual. And so the Sex Smart Films, Sinclair, these are excellent videos and give a very good visual representation of different things that can be tried.
Without being pornographic.
And I have to say, at the same time, there's absolutely nothing wrong with porn.
No, there's not, but some people.
And that starts getting, on the boundaries of certain religious beliefs. But for those that don't have those religious beliefs, I'm a firm believer that people should have unlimited access to their sexuality. And the way you discover unlimited access is to experience all the other things that perhaps other people are experiencing that you may not live long enough to experience all those things.
And there are several Christian and very religious-based sex therapists that can help you explore that if it's something you're struggling with your own personal beliefs and your own physical desires as well.
Right. So we find that all of these things can enhance a person's libido, can allow them to explore new avenues and have new levels of excitement. And certainly, and there's an enormous amount that one can explore. One can explore books to read that have sexual themes. One can explore erotic poetry. There's just so many things out there, and you just need to open yourselves to explore these different avenues. Well, I think we covered it.
This was so much fun.
This was a lot of fun.
I hope you guys watch it and enjoy it.
Yes, so watch it, enjoy it, communicate with us, and email us if you have any new ideas that we didn't cover.
You know what I just remembered is dilation and intercourse while you're pregnant.
Yes, I made a note that we shouldn't forget that. Okay, so now you guys are way months afterwards, and it's ready to make a baby. So let's talk about pregnancy, because we must not forget that.
You can still have intercourse and dilate while you're pregnant. Most likely, if you have a vaginal birth, you probably are not going to need to dilate again. However, you may after that. It just depends, because there are some secondary vaginismus cases after childbirth. So we're just going to go back to basics. As long as you're having a normal, problem-free pregnancy, you can have normal intercourse and dilate normally. If your doctor says you have any issues with cervical integrity, then you need to kind of be careful, because you don't want to be bumping into the cervix a lot. So if you have that, make sure you definitely talk to your doctor about that. However, it's perfectly fine. You can have intercourse. You're not going to cause any damage. You may have to play around with your positions a little bit to make it more comfortable, especially as the belly is growing and the baby is growing. You can dilate as normal, whatever you can tolerate and whatever you need, and have no issues.
So it's always best to check with your doctor. He's the person, he or she is going to be the person examining you and counseling you and telling you what's recommended and what's not recommended. And Ellen and I feel very strongly that every patient needs to be an advocate for other patients, an advocate to get the word out that there's something called vaginismus, and that it's probably as common as erectile dysfunction. and that women don't have to live in secret about it, that you can talk about it, that people can say the word vagina, it's okay, and you can say I have vaginismus, and that's okay. And right now it's not, but we have to change that, and the way we can change it is if there's enough of a groundswell of people who are enthusiastic about changing this, and our patients are really coming through.
They are, they're great. I've cried with them, I've laughed with them, I get all excited.
Right.
That's what it is.
Okay, so any further questions? You know where we are, you know how to communicate with us, and we wish you the very best of luck.
Thank you.